everybody, I'm Georgia Cassidy, and I'm one of the instructors here for 271. And since there is no one else in the room right now, I am going to take off my mask. But this way, you get to see me better. And we're going to talk about postpartum. Now, I know that you're going to watch a film, or you may have watched a film called Jackie and Niles Are Having a Baby. And one of the things that we had asked when you're watching the film is to jot down some words that maybe you're not familiar with. So I just did this because if I was a student, this would be some of the things that I would think might be important that I might want to look at. So the word contractions, the words dilation. Here they talked about the difference between 6 centimeters and they talked about 10 centimeters. They talked about the word effacement. Also, you heard the word doula. There was a doula in the video. Jackie did receive an epidural. And the doctor at one time talked about breaking the water. So those are just some things that if I saw the video and I was a student, I would be looking into that information. All right? So I just wanted to bring that to your attention. But today we're going to talk about postpartum. All right? So first thing is, when does the postpartum period begin? Right? The postpartum period begins after the delivery of the placenta to the involution of the uterus. And what does that mean? It means that the uterus has gone back to the pre-pregnancy state. That's what we're going to talk about. All right? When you're on the postpartum unit, there's a lot of different things that go on, but one of the first things that you're going to see is that there's a lot of safety measures. And one of the first things that you're going to notice is that mom will have a bracelet on, and also the baby will have a bracelet. So a lot of times when the baby is brought to mom from the newborn nursery, or the baby is there and you're doing an assessment, before anything else, you're making sure that the right baby is with the right mom, and they will have the same number, the same identification on the bands. So that's the first thing that I want to bring to your attention in order to keep mom and baby safe. Now when you do a postpartum assessment, right, it's the same thing where you always start with a head-to-toe assessment. A head-to-toe assessment, all right? And then you're going to learn what we also call, we're going to add the bubble heat. But we'll get to that, but I just want to stress with you that, again, you're doing a head-to-toe assessment on mom. Let's talk about vital signs. If you were going to do an assessment with your patient, you'd want to make sure that you do vital signs. So what would be a normal vital sign of a mom that's postpartum? First thing I want you to know that after mom delivers, now remember there's 2 passengers, because there's a passenger of the baby, right? And we said that postpartum begins with the passenger of the placenta, all right? That starts the postpartum period. Now, vital signs, let's talk about that, all right? Heart rate should be within a normal heart rate for an adult. Blood pressure. Blood pressure will go back and should go back to like her blood pressure that was in the first trimester or pre-pregnancy blood pressure. Respirations should be normal, all right? And also temperature. Temperature sometimes, a mom could have an elevated temperature 100.4, all right? And that's normal. And why would mom have an elevated temperature like that? It's probably because of losing the fluids and different things that may happen. However, if mom has a higher temperature, like if her temperature was 101, what would we be concerned about then? We would be concerned about infection. So just the first 24 hours, if you see that the temperature is 100.4, if it's as high as that, that is considered normal. So we talked about the normal. What did we just say? We were talking about the abnormal. We would say if mom had an infection, right, she may be having a temperature of 101 or greater. Also, is she tachycardic? Maybe she had a very difficult labor. Maybe she's very, very tired, whatever. Maybe she lost a lot of fluid. If she became very tachycardic. Also, want to make sure that we check her respiratory status, all right? Is she tachypnic? Is she short of breath? We should not see those things, right? Respirations, everything should be normal. So we talk about vital signs, sometimes we talk about the fifth vital sign. What is that? Pain, all right? So mom may be experiencing some pain. She may have had an episiotomy. She may have had a C-section. So we're always going to make sure that we assess mom's pain and that we appropriately handle the pain. All right. Now, I want you to understand that with postpartum patients, the first hour is very critical. It can even be the first 2 hours, but usually it's the first hour is very critical. So you're going to find that vital signs are taken more frequently. Vital signs may be taken every 15 minutes. All right. There's going to be a policy and procedure in place, and as a nurse and as a nursing student, you would ensure that you were following the policy and procedure in place. But also remember your nursing judgment. All right. There may be times that you want to do something a little bit more. You want to dive in deep to make sure that mom is safe, okay? But you will be taking vital signs much more frequently, all right? So every 15 minutes, you would be assessing mom. You would be having the vital sign machine up. You would be doing everything. You'd be talking to her, all that, all right? Why? Because we want to ensure that mom is safe. All right, that's what we're going to be doing. And right now we are focusing on mom. We're talking about the postpartum assessment. Newborn assessment is something completely different. So you would be assessing mom. That's what we're talking about here. All right. So one of the things that we're concerned about right afterwards is we're concerned about mom hemorrhaging. Right. We don't want to have that atony of the uterus. Right. We want to make sure that the uterus can contract. Right. Because that's part of the way that a hemorrhage won't happen, because at that placental site there's no blood clot there, so that needs to form in order to not have any type of hemorrhaging. All right, so what we're going to do now is we assess the breasts, and we're going to go down and we're actually going to assess the U in bubble heat, which is uterus. So we're really going to be looking at her fundus. So we're going to walk over here because I have another mannequin over here actually of the fundus. So let's talk about delivery. So after mom immediately delivers, the uterus, right, is halfway between the pubic symphysis and the umbilicus. And then an hour after birth, what it does is it rises, right? And what is the fundus? The fundus is the top of the uterus. So what we want to do is we need to make sure, right, we need to assess that fundus. Why are we assessing the fundus? Because we want to make sure that mom is not hemorrhaging, all right? So what you would do is you feel where the top of the fundus is. Now I'm going to tell you, sometimes you have to press. You cup your hand and you have to press. And what it will feel like is it's going to feel like you'll feel something hard. It almost feels like you're feeling the top of a ball, all right? And then what you do is you put your hand here, lower, right? Because you want to feel exactly where it is. The fundus should be getting firm, right? It should not be boggy. If it was boggy, that would be very concerning, because it may be a sign that mom is not contracting, that she is hemorrhaging, all right? So this is how we feel it. Now, even if a patient had a C-section, you still have to do this assessment. So just be careful, because on the top you are pressing down, but you may have a surgical incision here where your hand is very close to it, all right? But you feel the part of it, all right? One thing that can happen as well is that we want to make sure, right? Mom could have a Foley, maybe she doesn't have a Foley, all right? But we want to make sure that bladder isn't full. Because if the bladder is full, what happens is it can push the uterus, like usually to the right, but it could be pushed out of alignment. And what happens there, if that happens, is then it can't contract. If the uterus can't contract, if that muscle can't contract, what happens? Then we could have a situation, right, where mom would be, at risk for hemorrhaging. So we want to make sure about that. Now, I said to you that after the hour after birth, that the fundus rises and it goes up to the umbilicus. Then what happens daily is that the umbilicus, the fundus should be decreasing in size from the umbilicus by 1 finger breadth or 1 centimeter. So if it was 2 days, we should be able to get 2 finger breaths, 2 centimeters, it should be that low, right? One of the things that we will be assessing. I'm going to go back to mom. So we talked about breast, we talk about uterus. The 2 next BBs in our bubble heat are bowel and bladder. Talked a little bit about bladder over there, the importance of mom urinating. Now let's go to bowel. When was the last time mom had a bowel movement? You know, she goes 2 days without having a bowel movement. Maybe she needs a laxative, all right? She might be very concerned about having a bowel movement if she's had an episiotomy, all right? So at this time, this is a good time where you're also talking to mom about her hygiene and how she will care for herself, all right? Some hospitals where they will be telling you that the patients, they want them to have a sitz bath or just a peri bottle, which will have water in it, so when mom goes to the bathroom, she can also like clean herself, all right? So that will be something else that you would talk about. All right, L. So what does that L stand for in bubble heat? Something else that we need to assess, and that is the lochia. So here we have, I'm walking over here. Here we have 3 different paths with lochia, all right? First, what you will see is you will see lochia rubra. Next one, you'll see lochia serosa. Next, you will see lochia alba. When you assess the lochia, what's also important is not just the color, is also the amount and how much. So for instance, if you have lochia rubra and mom is saturating this pad, all right, in an hour, we know that she's bleeding too much, right? Again, what are we concerned about? We're concerned about hemorrhage. Usually the rubra you see till day 4 or day 5. Then you'll see lochia serosa, all right, where it's pink. That can be anywhere from day 10 to day 14. Then you go to lochia alba, which is white. It could be a little bit yellowish, some type of clear. In regards to the amount, we talked about the amount. Also, is there an odor? Because we would be concerned about infection. The other thing is, let's say mom, had rubra, she went to serosa, and then she went back to rubra. That's something that we would need to educate mom about, because that could mean if she's not going from rubra to serosa to alba, all right, not doing that progression, it could mean that she's hemorrhaging. So these are all the type of things. So this is something that mom would need to know, that she'd need educated, because when she goes home, if that happens to her, she has to know that she needs to immediately call her physician, her OB. I'm going to walk back over to mom. So we did our B, we did our U, we did our 2 Bs, we did our L lochia. Now we're talking about E, all right? And what does that E stand for? That E stands for episiotomy. So I'm just going to, remember, we always want to give mom her privacy. So move this up, all right? So you want to see how mom is doing, all right, with the episiotomy. Now when you get to this point and you have to assess mom, it's very important as well. You just don't want to assess from looking at her anteriorly. You're going to need to tell her that she's going to turn and that you need to do that. Why? Because mom could be bleeding and it could be pooling underneath. And if you just look from this particular angle, you may miss that, all right? So it's very important that you would tell mom to turn, and that this way you're going to be able to see the area. The other thing is, if she's had an episiotomy, right, it heals pretty fastly, all right? Sometimes what there is, there's sutures there that will dissolve, all right? But if mom starts complaining of excessive pain, all right, or you notice that there is a hematoma, all right, that also could be a sign that mom is hemorrhaging. So we have the B, the U, the BB, the LE. Now we're getting to the HE, the bubble he, all right? And what could that mean? What is that H? Getting right down here, that H is for Holman signs. What is a Holman sign, all right? What we're concerned about is that mom doesn't develop a clot in her lower extremities, all right? So what you would do is you would just, have mom lay there, and you would dorsiflex the foot up to her and ask her if she's experienced any pain. If she's experiencing any pain, that's often a sign, right, that someone has a DVT and that they're probably going to need to do additional testing to see if a clot is there. What other things we might assess with her leg? Is it warm to touch? Is it swollen? She probably is going to have some swelling here. She's going to have some edema to her lower extremities. Think about that. Why would she? Because cardiovascular-wise, right, with mom carrying that baby, she's probably had an extra, 1,500 mLs of fluid that she's been carrying around that her heart has had to pump. So what is it going to do? It's going to pull in the legs. So I would also be looking to see how her legs look, how edematous they are. Does she have any type of pitting edema? All right. And I would do this for both legs, all right, for both, bilaterally. Now, DVTs are usually, or they are, unilateral, all right? So if mom is complaining of pain in both these legs, it very well could be from having her legs that she had in the position when she was giving birth in the stirrups, and from pushing, it's probably some type of muscle strain. But that is something that you would contact the doctor about, just to let the doctor know, and then they'll decide whether they want to do any type of Doppler to see if she has a DVT. Going to put the blanket back up here. Give mom some, make sure that she's nice and warm. All right. We went for the B through breast. We went for the U for uterus. We did BB for bowel and bladder. We did lochia. We said that this E here was for episiotomy. We talked about the H, which we talked about home and signs, so checking mom to see, does she have a DVT? And what is this last E? It's for emotions. So remember I said to you that we started off with doing a head-to-toe assessment. We were talking to mom. So we want to make sure, see how mom's emotions are, all right? See what her background is. Does she have a history of depression in the past? Would she be, if she does, right, would she be at higher risk for postpartum depression? She definitely would be, all right? So we want to see how she is with her emotions. Women who have postpartum depression, that's something that, it's something that can be managed. They may need therapy. They may need therapy and medication, but it is something that can be managed, all right? And sometimes they just need to know that, and we get them to the right resources so that they can be helped, all right? But you will see that as well. So we just finished the mnemonic bubble heave, but we see here another mnemonic. Nurses love mnemonics, right? Things that help us in order to assess the patient safely. And this is Rita. So Rita really is a mnemonic that goes back to the episiotomy, to assessing it. So what are we going to assess that episiotomy for? Redness, edema, ecchymosis, any type of discharge, and approximation. Remember, we want to see that it's approximated, right? This is a surgical incision that was made, so we want to make sure that it is approximated. So here you see today that this is just to give you some things, some terms that we use in postpartum to help you the first day that you're on the floor, all right? And I wish you a lot of luck. And bye-bye.